of your insight here. Next up, we're going to have Dr. Joseph Meaney, who is the president of the National Catholic Bioethics Center. Dr. Meaney received his Ph.D. in bioethics from the Catholic University of the Sacred Heart in Rome. His dissertation topic was Conscience and Healthcare, a Bioethical Analysis. He was director of international outreach and expansion for Human Life International and is a leading expert on the international family movement, having traveled to 81 countries on pro-life missions over the last 25 years. He founded the Human Life International Rome office in 1998, lived there for 9 years, where he worked closely with the Holy See. He was the general editor and English edition co-author with his father, Dr. Michael Meaney, of a chapter in the Pontifical Council for the Family's Lexicon. And he's published in a number of scholarly journals and hundreds of op-eds and publications as well. So Dr. Meaney, thank you so much for joining us.
It's a pleasure. Thank you very much. Yeah, so I'm just going to very briefly talk about the ethical issues that have been coming up during this COVID-19 crisis. And something that I thought was very, very apropos came out of the United States Conference of Catholic Bishops, the USCCB. Early on, they sent out a statement on rationing. And one of the things that they said really made a lot of sense. Every crisis produces fear, and the COVID-19 pandemic is no exception. However, this is not a time to sideline our ethical and moral principles. It is a time to uphold them ever more strongly, for they will critically assist us in steering through these trying times. And you know, there's been a real temptation. The temptation is to think that because we're in, a serious health crisis, where, we're running out of resources in some situations, where hospitals could be overwhelmed with patients, et cetera, that ethics is not important, right? That we can do without that. That is sort of a luxury. And that instead, we just have to take a utilitarian approach and do whatever needs to be done to save the most amount of people, even if we have to commit injustice or if we have to, basically allow people to die. So this is a very, very important point. We cannot allow the culture of death to take the lead on the response to this pandemic. And there was an exponent of that culture of death, as St. John Paul II called it, who said, many years ago, never let a good crisis go to waste. And they have this idea, right? Wow, we can really, move forward here on, euthanasia, assisted suicide, allowing people to die, et cetera, because we have this crisis. And so, unfortunately, as, more and more opinions and more people were getting sick and hospitals were filling up, et cetera, in certain parts of the country, certainly, these proposals started coming out, rationing proposals that were clearly discriminatory. So, and we've heard out of Italy and other places that were very hard hit by the pandemic that some of these rationing protocols that were being put into place said, if you're a certain age, you're not going to get the ventilator. You're not going to get into the ICU because we are reserving that for sick patients that we can treat. And some of these triage protocols were clearly discriminatory. Now, thank the Lord that we have such good people in office right now at places like Health and Human Services. So Director Severino at the Office of Civil Rights of HHS came out very strongly saying, look, discrimination in healthcare will not be tolerated. It will be prosecuted. And you can't use the excuse, that you have this crisis to discriminate. Rather, and this is what the NCBC and what the Catholic bishops and everyone else has been saying, you have to use objective clinical criteria. So what does that mean? That means that you have to treat patients based on the ones you can save. Now, in a triage situation, triage, of course, comes from the French triage, and it was developed on the battlefield. And the idea was to divide into 3 groups. The first group were the patients who could recover without any medical treatment immediately, and so you didn't have to rush to their side. The second group were individuals who were not going to recover. They were mortally wounded, and there was nothing you could do to save them. And unfortunately, the only thing you could provide is sort of palliative care, but they were not able to save them. And then the third group were those that were critically wounded, but if they were treated quickly, could recover. And so the triage would focus on that third group. And it makes sense, and it's ethically acceptable to do that. However, and the key point is, you should not discriminate against individuals for any reason other than the fact that you can't save them. If you can save an individual, you should try and do that, and you should use the clinical criteria like the SOFA protocols or the Apache 2 protocols, et cetera. The sequential organ failure assessments, et cetera, to determine which patients should have priority and which patients can be saved and therefore should get as much treatment as possible. Now, thankfully, very few hospitals have had to activate these triage protocols. Very few hospitals have been put into that situation. So it's not turned into a reality outside of a very few hotspots in the country. But there was a big debate, and the culture of death was very, very active, saying, we should have universal DNRs, do not resuscitate orders. Now, that is a huge ethical violation. A do not resuscitate order that is just blanketly imposed, right, without any informed consent, et cetera, is not acceptable ethically. Now, you can have a DNR order that is put into place in certain circumstances, and it could be appropriate to do that, but it is never appropriate just to determine ahead of time that all patients coming in with COVID-19 are going to be DNR patients, because some patients should be resuscitated. Others, perhaps not, right? Because they're so badly off that they're not going to be able to be saved. But that decision is not made a priori before. It has to be made on a case-by-case basis with these patients and in consultation with their families. And I think that the next speaker is going to talk about some of the violations that have occurred of religious liberty. But one of those, is the fact that a lot of hospitals are not allowing family members to visit their patients, but also even clergy to provide the last rites. And we've been protesting that, and others as well. But it's an important point, right? Is that we have to be advocates for our loved ones who are in the hospital. And as, even as healthcare workers, we have to be advocates against the system, which might be trying to impose these DNRs universally, et cetera, and to work against that. So the other issue that was raised earlier is the one about vaccine development. And it's a very, very important issue. It's one that has been going on for many years now. And it's a fundamental point. A fundamental point is that, the Catholic Church does not believe that a good end justifies bad means, right? We're not Machiavellians. And so vaccine development has to proceed using ethical means. And it's absolutely possible to do so. Unfortunately, some companies have chosen to use cell lines that were derived from an abortion that happened many years ago, like the HEC 293 cell line. So these are cells that were obtained from an aborted child, and then over the years they have, of course, multiplied many, many different times over. But the whole point of these cell lines is they're ethically tainted, right? They began with an abortion, and there is no need to use them. I mean, some of these vaccines that are under development are being developed using cell lines that came from insects or from human beings, but they were obtained ethically with informed consent and without killing the person who gave the cells, et cetera. So it is not necessary. And again, the USCCB, including the NCBC, the National Catholic Bioethics Center, of which I'm a part, we have strongly urged. There was an open letter from the USCCB that was sent to the Commissioner of the Food and Drug Administration saying, look, it is unacceptable that when there are alternatives out there to develop vaccines based on these ethically tainted cell lines. It really all goes back to what the Congregation for the Doctrine of the Faith said in 2008 in their instruction Dignitatis Personae. They said, look, even though we are temporarily removed, there are many years, sometimes as many as 50 years since the abortion actually happened for these cell lines, there is no ethically good reason to use those cell lines. We should be using other cell lines. Now, it is a completely other question, if a person has only the choice of a vaccine, and unfortunately in the United States, there are several vaccines that there is no choice except to use a vaccine that has come from an ethically tainted, using cell lines that originated in abortion. Now there it becomes a question of, material cooperation with evil, and there's a whole discussion. But when we're talking about the development of vaccines, in their development, there is no excuse whatsoever to develop a vaccine based on these ethically tainted cell lines. So that is a really important point, and we're so glad to see, right, that the federal government at least is working on this, and also the companies have seemed to see the light. I mean, right now we're aware of 16 vaccine development programs for COVID-19 that use ethically good cell lines, and then only 5 that we're aware of so far that are using the ethically tainted ones. So it's good to see that companies have been responding positively. Even the development of the Shingrix vaccine against shingles used ethically good cell lines in order to do that. That was wonderful to see, and they realized that individuals are concerned about this, and they don't want to have even a remote cooperation with abortion. They want to have an ethically clean procedure. So I guess I'll stop there. I mean, the other fundamental ethical question that has been raised by this whole crisis really is, is the cure worse than the disease? In other words, we always have to keep that in mind, right? The extraordinary measures that have been put into place to fight this disease have to be justified by the number of people that are sick and the number of people that are dying, et cetera. Now, granted, this is a very grave situation, but it is also very, very grave to shut down a country. And there are people who will die simply because they lose their jobs and they commit suicide, or there's a greater risk of drug abuse, alcohol abuse, et cetera. So it's interesting to note, now I'm not saying that we have crossed that line, but it is important to realize that from an ethical perspective, we have to evaluate whether all these extraordinary measures are still justified. And we have to continuously evaluate that, whether we should be opening up or not, and how quickly, et cetera. But that is a massive ethical issue as well with this crisis. So I'll stop there and either answer some questions, or I know we're a little bit behind time also.
Thank you. Thank you so much, Dr. Meaney. Yeah, there are a lot of questions. I'm not really sure how to get to, or how to sort through all of them, but I guess just you hit really one of the main ones, I think, which is about some of the vaccines and being ethically derived, and I don't know if you could speak a little bit about like material cooperation with evil, or if you feel necessary. If not, that's fine.
Yeah, I mean, so this is an interesting question that has been raised about vaccines in the past, right? So, and it's a little bit of a complicated point, but to make it as simple as possible, right? We can never formally cooperate with evil. We can never agree with another person's evil action. But at the same time, there's a thing called material cooperation, where we're cooperating with someone who's doing evil even though we disagree with them. And the question is, how close of a material cooperation is sinful, right? How close is morally acceptable? And generally speaking, Catholic moral theologians and ethicists will say it has to be a very remote material cooperation, and you have to have a very serious reason to do so. Now, we live in a fallen world, so it's impossible not to have some kind of material cooperation with evil. My favorite example of that is taxes, right? If you pay your taxes, some of that money is probably going to go to an evil activity that you would not want to cooperate with. However, if you don't pay your taxes, there are huge amounts of, there's a huge downside to that in terms of how society is going to function, what is going to happen to yourself, et cetera. It seems disproportionate to refuse to pay your taxes based on, a very remote material cooperation going on. And there are many other elements of that. If you go to the grocery store and you buy a product, that company that produced that product might be, contributing to Planned Parenthood, or something like that. So there's almost an impossibility to avoid all cooperation with evil. So then the question is, what is remote enough? And that is involved in how you form your conscience. And each individual has to have a very good, well-formed conscience. Now, a lot of moral theologians will say, look, if you have a grave need to vaccinate, because it's a serious disease, et cetera, and the only vaccine that is available has a remote connection with abortion, an ethically tainted cell line that is the origin of that, can you licitly choose to do so? And the answer, the vast majority would say, yes, you could, because it is a very remote cooperation with evil, and you have a sense of, a need to do so, to protect others, protect yourself, protect your child, etc. Then you could choose that. At the same time, if your conscience really bothers you about this, and you do not want to go, there is no obligation, like a moral obligation, to use that vaccine at all. You could conscientiously object to it and say no. So it does come down to an individual conscientious choice, but it is an important point that we should not be putting people in that situation in the first place, right? It is very easy to develop these vaccines using ethically good, sound means. And sadly, some companies just kind of disregard this, which is a tragedy. And so it's good to see the bishops and even the administration going out and telling these companies, look, we need good, ethically sound vaccines. We don't need to have, more reasons out there for people not to get vaccinated.
Mm-hmm. Great. Well, thank you so much, and thank you for your insight here. And where should people go if they want to find out more information?
Yeah, absolutely. So we have a whole section on our website, ncbcenter.org, on COVID-19. We've touched a lot on these rationing issues, on the duty to care, and healthcare workers facing these situations. Some resources on access to the sacraments, particularly sacrament of the sick, which could be very useful for chaplains and others. And we've just kind of kept a continuous update of ethical material as we've worked with hospitals and healthcare professionals. So ncbcenter.org is a good place to go at our COVID-19 section.
Great. Thank you. Thank you very much.